Chronic fatigue syndrome: causes, symptoms, and treatment options. Do you always feel fatigued? If the answer is yes, then you're going through chronic fatigue syndrome. Watch this video to the end to get the causes, symptoms, treatment of chronic fatigue syndrome, and also medications to take to help out. But first things first, let us find out what chronic fatigue syndrome is. So what is chronic fatigue syndrome? Chronic fatigue syndrome is a complex disorder that can be hard to diagnose. Chronic fatigue syndrome is an illness characterized by debilitating fatigue lasting for more than 6 months and which doesn't improve with rest. It can also include cognitive problems, pain in the digestive tract, and other complications. Chronic fatigue syndrome can make it difficult to perform even the simplest daily tasks. Although the cause of chronic fatigue syndrome is not yet known, there are various ways to manage symptoms and live a fulfilling life. There are many possible causes, including viral infections, autoimmune issues, depression, and hormonal imbalances. The most common treatment option is cognitive behavioral therapy combined with medications. It is important to find a doctor who specializes in chronic fatigue syndrome to understand what might work best for you. Common symptoms of chronic fatigue syndrome: fatigue is the most common symptom of chronic fatigue syndrome. It can be debilitating, preventing an individual from doing the activities they would otherwise do. The severity of this fatigue varies from person to person, but it can make it difficult for people to maintain their daily routine. Symptoms of CFS also include cognitive problems like difficulty concentrating and remembering things, pain in the digestive tract, and other complications. Chronic fatigue syndrome is not well understood in terms of its cause or treatment options. There are many possible causes, including viral infections, autoimmune issues, depression, and hormonal imbalances. The most common treatment option is cognitive behavioral therapy combined with medications. It is important to find a doctor who specializes in chronic fatigue syndrome to understand what might work best for you. Causes of chronic fatigue syndrome: chronic fatigue syndrome has many possible causes, including viral infections, autoimmune issues, depression, and hormonal imbalances. There are 2 types of chronic fatigue syndrome. The first type is called myalgic encephalomyelitis, ME. ME affects the brain and spinal cord in addition to the muscles. The symptoms are severe and constant. The second type is called chronic fatigue syndrome, CFS. CFS is more common in adults than children. It affects people differently and symptoms can change over time. Both myalgic encephalomyelitis and chronic fatigue syndrome are characterized by debilitating fatigue that lasts for at least 6 months, but can last for years or longer. Extra symptoms may include pain in the digestive tract, cognitive problems, sore throat, swollen lymph nodes, headaches, light sensitivity, or other complications. Treatments for chronic fatigue syndrome: chronic fatigue syndrome is sometimes confused with depression, which can lead to treatment that doesn't work. There are many treatments for chronic fatigue syndrome that can help you recover and live a normal life. Cognitive behavioral therapy is one treatment option that helps by changing the way you think about your illness. Antidepressants might also be necessary if CFS has become severe enough to affect your moods. If you don't respond well to cognitive behavioral therapy or antidepressants, it might be time to consider other treatments like pain relievers or anti-anxiety medications. It's important to talk to your doctor about what might work best for you at this point in your illness. Cognitive behavioral therapy. Cognitive behavioral therapy has been shown to be an effective treatment option for CFS. Cognitive behavioral therapy is based on the idea that you can modify your thoughts and behaviors to improve your physical health. There are a few different types of cognitive behavioral therapy, including cognitive restructuring, acceptance and commitment therapy, and graded exercise therapy. A doctor may prescribe one or multiple therapies to help manage chronic fatigue syndrome. It is important to work with your doctor to find what works best for you. Medications. There are a variety of medications prescribed for chronic fatigue syndrome. They can be used to help manage the symptoms of CFS and restore your energy levels. Antidepressants or hormone replacement therapy may also be recommended for people with chronic fatigue syndrome who have depression or other emotional problems causing their fatigue. The doctor can help decide what is most appropriate for you, but some people find they do not respond well to medication and instead use alternative therapies like herbs and supplements. Don't forget to subscribe to my YouTube channel for more awesome videos like this.